So hello, everyone. Thank you for joining us for the Entrepreneurial Lunch and Learn offered by the Lawrence and Phil Center for Entrepreneurship at Baruch College. I am Gary Smalls, the program coordinator here at the Phil Center and your host today. The Phil Center for Entrepreneurship is a multifaceted division here at Baruch College, offering free services and programs for the entrepreneurial community. And this is one of those resources for, and one of those programs for you guys. Today's Lunch and Learn webinar is presented today by Jonnel Doris, the Chief Executive Officer for the START Treatment and Recovery Centers and the former Commissioner for the New York City Department of Small Business Services. START, which was formerly known as the Addiction Research and Treatment Corporation, or ARTC, began treating patients in a single building at 937 Fulton Street in Fort Greene, Brooklyn, and is now one of New York State's largest non-hospital providers of health and human services. For more than 40 years, START has offered treatment to over 40,000 self-referred patients throughout Brooklyn, Manhattan, and the Bronx. So thank you so much for being here with us today, Jonnel. Please feel free to tell our audience a little bit more about you before you start your presentation.
Thank you so much, Gary, and thank you all for joining everybody. And I would say a little bit more as it pertains to START, since that's where we're starting from. The organization is really 53 years old and founded by pioneer and Black doctor, Dr. Benny Prim, and who we've been doing this work for 53 years, biomedical research, helping with and working with many patients, 53,000 plus in New York City, across our clinics in Brooklyn and Manhattan, and bringing real change to those individuals' lives. We work in areas of substance use disorders, also with primary care services, mental health services, and also with our young people, our Teen Start program. And so, we are very excited about the work we're doing and what we're endeavoring to do going forward. And as Gary mentioned before, this role, I was the Commissioner of Small Business Services for the city, and at a really rough time. It's a time during COVID, and I'll talk a little bit about that in my presentation. And then before that, I was leading the city's minority women-owned business program as the first city senior advisor and director of the mayor's program in the mayor's office. So, where we certified over 10,600 businesses, where we to engage in city procurement and private sector procurement, where we opportunities where we awarded over $14.6 billion to these firms. We launched all types of funds to help them with their access to capital needs, which we're very excited and was really happy to have several banks join us in creating these funds. One an emerging developer fund, another one a contract finance loan fund, another bond fund that we created for our businesses in our programs. And so, I've had a really amazing career working with small businesses. Now I'm just delighted to be teaching a course here at Baruch. And, happy to come back to talk a little bit about something, a little bit different around how government and government policy and action sort of impacts small businesses and their workforce. And so when we think about, the Global Entrepreneurship Monitor, the GEM, some of you certainly know about it. They assess entrepreneurial conditions in 50 countries across the world. This particular survey did about 2,000 experts across 50 countries and looked at 13 various conditions. Out of that, the United Arab Emirates and the Netherlands and Finland sort of came in on top. The United States was a little bit further down in the stats there. But they looked at these 13 entrepreneurial framework conditions that included entrepreneur finance, the ease of access to entrepreneur finance, the entrepreneur education at school, entrepreneur education post school. Then there is sort of research and development transfers, commercial and professional infrastructure. Also talked about entrepreneur education at school. Then it talked about the ease of entry, right, into entrepreneurship, burdens and regulations, physical infrastructure, social and cultural norms. But they also talked about government policy, support and relevance to entrepreneurship, government policy as it pertains to taxes and bureaucracy, and then government programs as it pertains to entrepreneurial programs that government actually engage with the entrepreneurs and businesses. This all confirms, right, out of the 13, we have at least 4 that we can point to that directly speaks about government involvement in policies and how those policies impact the ability of small businesses to start, to grow, and to thrive in a particular economy. We understand government investments, sort of grants, loans, technical assistance, and supports are vital. Also facilitating sort of networking opportunities, which government is the great convener. And I think that also is a critical component. And then, creating a fair and workable regulatory environment. I say fair and workable because we want a regulatory environment that is fair, that also, really deals with the hard issues of keeping us safe and keeping the market fair, but also workable, meaning that it's flexible, that we have the opportunity to influence that process for the betterment of the economy and small businesses altogether. And then, as most recently, as we hear about of the economy, so dealing with the Fed policies along the lines of inflation, or their lending policies. When we talk about interest rates as well, and how the Fed sort of plays a role in a robust economy, it all again reiterates this fact that government does play a significant role in the success, in the ability to start, to grow, and allow your business to thrive. And all these components sort of facilitate that, right? And these components help either promote and encourage, or they stop you from actually starting your business and or engaging. So, in New York City, we had 240,000 small businesses with employees. Half of them are immigrant owned, just about, were greatly impacted by COVID-19, okay? At the time before that, we're employing, about 4 million people. We saw the employment rate during COVID spike up to close to 20%. So you're hovering around, a little under 1 million people at one point out of work or looking for work or engaging in the unemployment process. And, here in New York City, we saw also that, COVID had and continues to have a real impact on small businesses. Businesses were dramatically impacted by COVID-19, right? 26 to 41%, particularly in the minority and women-owned business spectrum. They said that they were looking to close. Some of them ultimately didn't, but the impact it was having as we sort of navigated this new world of COVID. Businesses also owned by people of color and immigrants suffered disproportionate losses. We saw that, within certain industries have been unevenly impacted by COVID. Industries with a high percentage of in-person businesses, such as retail, restaurants, all were hurt. Professional services, all were hurt in a more disproportionate way. 75% of retailers predicted that I'm giving you some stats at the beginning of COVID as we went through it as well. So 75% of them didn't think they were going to make it past 6 months. 78% of personal services thought the same. 85% of restaurants, bars, catering, shuttered venues, all of these thought that they were not going to make it past 6 months to a year. And, without some sort of infusion of cash or involvement from somewhere. Well, as we look back, we knew that most small businesses were financially fragile and continue to be today before the start of the crisis, and did not have the reserves to handle a crisis of this scale here in NYC. The average cash on hand was around 28 days, but for certain communities, it was 1 week of reserves that these businesses have. In the first month of COVID, again, just taking it back, minority businesses, Black businesses, Latino businesses, Asian businesses saw significant 1/3% or so drop in the number of businesses that were engaging, that were working, that were open, that were trying to survive. Immigrant businesses, we saw a drop of about 36%. Female-owned businesses were also disproportionately declining by 25%. And so this is, we're talking about the engagement of the business, both starting, conducting businesses, being open and ready to be engaged. The pandemic just did a number. Research shows that the concentrations of female, Black, Latinx, and Asian businesses and industries hit hard by the pandemic contribute to why losses were higher for those groups than the national average loss. What does that mean? That means that, they were in industries such as hospitality, retail, et cetera, who were hit the hardest. Personal services, professional services. And because they were hit the hardest, because they have direct contact with individuals, those businesses went through another sort of level and layer of struggles and difficulty than others did. We also noticed significant factors such as supply chain disruptions, technology gaps, worker training deficiencies, and the change in customer behavior all contributed in the loss of business, small businesses, the loss of business revenue, workforce crises that came out of that, and growth stagnation. These factors illustrate the significance of health impacts on the economy. These factors illustrate why it's so important to really deal with health and the economy. Health and wealth, they go together. Healthcare is 19.7% of GDP right now. That's about 20% of GDP is healthcare. Disruption in this particular sector virtually impacts the entire economy. So when we think about healthcare, just don't think about going to the doctor and all, you just engaging with your primary care doctor. You got to think about the fact that this is an ecosystem that has impacted the way we live, the way we grow our businesses, and the economy in which we are now. So COVID was really a clear example of how entire economies and our way of life is impacted by the policies and choices made around public health, okay? Those choices were so critical. The health crisis brought on the economic crisis and exacerbated the known inequities in the system, both from a health perspective and from an economic perspective. This was sort of my mantra as commissioner, because what I was saying, I wanted to make it clear. I wanted folks to truly understand that the health crisis truly brought on an economic crisis. and not only brought on an economic crisis, but it exasperated the inequities within the current system, meaning that certain businesses and certain groups will be disparately impacted by the pandemic due to the existing circumstances that they were in. Okay. And so COVID mandates, right, that were instituted to deal with the health crisis. These businesses, were closing because of some of this to keep us safe. So we had a health issue that we had to deal and get under control. And it sort of spilled over again into our challenges as it pertains to our business operations. Okay. So business closures, particularly in hospitality and retail sectors, were devastating. We went from over 60 million tourists and folks visiting us to under 20. You know how many supporting businesses that impacts? A tremendous amount. In the COVID zones, if you recall, at the time, we had 77,000 businesses who were impacted within those particular zones across the city. We also had vaccination mandates, the safe and prudent public health decision, I believe, that was made to make sure that we keep each other safe. But that also had an impact on the workforce and businesses. It also had an impact on customer behavior. How customers are behaving is different now. You had customers moving away from, going out and shopping in person at retail. And so many of our small businesses were not equipped and ready for an online marketplace. We did a lot of work around that at SBS, but certainly a lot of small businesses were not ready for that. Some were relieved to know that, we were protected, but it also impacted their bottom line. Also, mask mandates. Again, a public health decision that's impacting a business operation and or the way the customer relates to a particular business or customer behavior, or consumer behavior. Government policies such as an example, I'm going to just go a little deeper. Government policies such as paid sick leave also gives us some insight of the dynamics between health policy and business success and employee success. So paid sick leave, we just heard there was some debate within the Congress concerning paid sick leave for rail workers. But in New York, paid sick leave was the law here from 2014, which requires employers with 5 or more employees and an income net of over $1 million to provide paid sick leave to employees. And for employers with fewer than 5 employees and a net income of over 1 million or less, to provide unpaid sick leave to employees. Paid sick leave drives employee health and mental health, okay? It drives it in the sense that is a positive driver. Employees with paid sick leave, we know, are more likely to utilize what we call preventative care, thereby lowering healthcare costs for themselves and for the business and for the system at a whole. Paid sick leaves also is seen to lower employee turnover, right? And that's very important. If you have a business, high employee turnover is expensive. So a lower employee turnover produces a savings for the business. So paid sick leave has benefited not only the worker as a workforce policy that was implemented by the government, but it was also helping the small business because it's driving up productivity, it's lowering costs because we're doing more preventive care, and the employee has a better mental health situation other than if they did not have that option. right? So employees with paid sick leave, we know for sure that they were more productive because of these reasons. Some other government policies, such as the Affordable Care Act and the Medicaid expansion, allow for more small businesses to provide health care to workers. Additionally, workers were able to receive comprehensive services such as wellness services through grants and incentive programs from the ACA. Again, government policy mandated healthcare, raising the number of folks who receive healthcare. Business productivity is rising, and then people are better because they're now be able to do preventative care, but also wellness services, not only at the expense of the small business, but in grants towards that or incentives to that small businesses. We look at OSHA requirements, also government action that's implementing everyday business operations. The Occupational Safety and Health Administration, it was OSHA 10 or 30. These are all safety mandates that impact the operations and the workers' safety. We had in the city site safety training is very important. Requirements for workers in construction or on a construction site to be trained an extra 40 hours or so. At the time when this was implemented, we were seeing a significant spike in fatalities and injuries at job sites. So a government policy, site safety training mandated, but we also understanding the costs to the small business supplemented MWBEs and small businesses as a critical component of the program. So from a regulatory standpoint, we also look at, the challenges that small business face. Again, government action or inaction and or apathy within a particular area and how it's impacting business operations and economy at large. So we looked at the regulatory standpoint and about 6,000 regulations, rules, that govern small businesses in the city, 6,000. So we looked at that, maybe about 1,600 or so really are the ones that are more active and directly impact the most businesses. So, we went about looking to reduce that burden on small businesses, right? So reduction in regulation and requirement really was a priority of ours, and it is for the current administration as well. They've been doing some fantastic work around this. And I think this is important to note that the regulatory environment, as I mentioned before, has to be fair, but also it has to be able to be adaptable and workable for it to be success. We also look at other government policies that impact the outcomes of government business operations. So we have privacy rules, and privacy rules and laws also impact business operations, establish mandates which businesses must navigate. So for instance, the HIPAA laws, the Health Insurance Portability and Accountability Act of 1996, it restricts private medical information from being shared, stored, and otherwise used. This creates, in many cases, a technology imperative, right? And it exposes technology gaps. So, and also operational needs for upgrades around matters such as electronic medical records that is used within healthcare businesses and healthcare operations. HR policies and business operations must safeguard now information of employees. This also impacts cybersecurity and a business's ability, small business ability to secure its digital footprint. So that was, again, an example of government policy that's being utilized and impacting, even if it's a positive impact for the worker, for the industry as a whole, there is an impact, right? And you've got to, have training. You want to work with your workers to make sure that we have proper compliance and adherence to the regulatory standards. All HR departments and those engaged in HR and just the operations of a particular business have to know the rules and how to apply them, right? And then ultimately, cybersecurity is a huge issue now. And you want to make sure you're safeguarding your information, your customers' information, but also as a healthcare provider, we have a very high standards that we have to meet to make sure that we are not allowing patient information to be shared in any way, shape, or form that is outside of the regulatory requirements. Again, policy that's impacting behavior as a business. In terms of workforce strategy for small businesses, health and general policy decisions made by regulators impact the ability for the business to hire and retain workers. For instance, when you have a higher minimum wage, we know it leads to higher productivity, right? I mean, it seems simple, but it's not. Higher minimum wages lead to higher productivity. So government will implement a policy or a directive based on, let's say, in the minimum wage. And, as the minimum wage goes up, we also find that productivity goes up. And in a place like New York City, where the cost of living is so high, we need to really talk about, cost of living increases. We need to talk about what it actually costs to live here and look at that in a way that is supplementing the work of the minimum wage and what the minimum wage does. But what's a real living wage? That's what we should be talking about. And that's about $24 an hour or so in the city right now. So think about that. But we know once we do these types of things that productivity goes up. We know that workforce investments by governments, such as subsidized training for vulnerable populations or tax incentives for employers to invest in employee training, are direct results of policies that impact the business sustainability. So, we had several of these types of programs. You had one program called Train Your Employees, where we trained employees on, basic technology shifts that are happening in the marketplace due to the fact that we're all online because of COVID. And employers did not have the ability to train their employees. So we started doing it for them as one of our programs, our 51 initiatives that we did at SBS when I was commissioner there. I would like to then sort of bring us back also a bit to, as the blurb went out on why we want to get together and talk about health and wealth and sort of the economy, and it pertains to healthcare. I'm in the space now, and certainly something that is much interest to me for some time, even going back to my high school days when I was studying to be a nurse, or college when I was starting to be a neurologist. When you think about this construct of the social determinants of health, right? And the implications on a business, health, and operations, we've got to take a look at that and to look at these particular issues. And this is why I'm excited today, because the social determinants of health is the factors that have major impact on a person's health, their well-being, and their quality of life. Health policy and government interventions, or lack thereof, in maintaining and supporting a healthy workforce is vital to the viability of the market. So the social determinants of health mandate health policy and government interventions to really support this healthy workforce that ultimately would drive business operations. So some of the social determinants of health are safe housing, transportation, the neighborhood that you grew up in or live in, racism, discrimination, violence, all social determinants of health, education, and here comes some of the economic ones: job opportunities, your income, your economic status, sort of access to nutritious foods, physical activity opportunities, who has the ability to have a gym in their community. When we talk about pollution, polluted air and water, all social determinants of health. Language and literacy skills, all of these things, social determinants of health. These social determinants of health and others contribute to many known health disparities and inequities, many of which not only impact the individual, but if we view our health and wealth as an ecosystem supporting each other and relying on each other, we can then assert that the social determinants of health have a driving impact on our economy as well, both from a cost to an individual perspective and also a cost to the business and the business operation. For instance, before and during the pandemic and now after, food insecurity as a social determinants of health has become one of the leading social determinants of health factors. Access to healthy, quality foods in local grocery stores, in LMI communities or low to moderate income communities directly impacts risk of health conditions like heart disease, diabetes, and obesity, and also lowering of life expectancy relative to people who do have access to healthy foods. We also saw those with multiple health issues were more likely to be more impacted by a COVID infection than others with their co-occurring or pre-existing health conditions, right? Such as heart disease, as we mentioned, and diabetes. So the social determinants of health impacted business operations from a jobs and industry perspective. For instance, we implemented the Open Streets program to support the hospitality industry, which was hemorrhaging due to the shutdown. That program saved about 100,000 jobs and impacted the 27,000 or so restaurants that are here in the city. The more health options, the better outcomes for health and business operations. Okay, we understand that. The more health options we had, the better it was, the outcomes for health and business operation. The cost is shared across the ecosystem, impacting businesses and communities alike. Okay, the cost is shared across the ecosystem, impacting both business and communities alike. This direct policy initiative was executed at the same time as the shutdowns were happening, and indoor dining was limited, and there were other restrictions. So when you think about what did the government do to help support not only healthy food, but restaurants and those who are in the food industry, hospitality industry, giving them an opportunity to survive and to provide healthy options for New Yorkers all across the city. And so that was very, very critical. And then on top of that, we are saving jobs and we're helping the economy and we're helping businesses to sustain. So the social determinants of health and associated health outcomes that really impacts the US business community, which has a real stake in correcting the health inequities as a strategy for stabilizing and strengthening the US economy. So when you think about social determinants of health, think about it as a tool to deal with the health inequities, but also to stabilize and strengthen our economy. So we know that business contributes positively or negatively to health and healthy conditions in an employee's life and in the workplace in so many ways, right? So you can have healthcare. We're talking about workforce health and safety, if they're actually adhering to that. We're talking about businesses who actually, help create in some ways greenhouse gases that really impact the environment, right? So businesses have a role to play here. Also, when you talk about sustainable technology, businesses that impact health and well-being, as we begin to focus in on healthcare through workplace wellness, as I mentioned earlier, Others are working in the philanthropic space, helping to deal directly with the social determinants of health. So business and business leaders really are now moving to a more involved and engaged model that is comprehensive in dealing with the social determinants of health and employee health in general. So while the focus is on the bottom line, which is important, we've got to also look and continue to look at the social determinants of health, particularly now that we've been through this pandemic, to really address how these policies and shifts and changes across the spectrum really impact, right, business operations and allowing businesses to start to grow and to thrive. There has been sort of an evolution in thinking about how worker health and wellness and so the social determinants of health impacts business outcomes. And also the health of the individual. We understand it in my field right now. 1 in 4 New Yorkers have some sort of mental health challenge or crisis right now. 1 in 4, think about that. 1 in 4, you look at 4 people, 1 in 4 of them have some mental health crisis coming out of this pandemic. So now really truly is the time, for government interventions and policy directives that not only identifies the issues around health and wealth, but produces the kind of actions and incentives to allow employers to support and foster greater health access and outcomes for workers. Thank you all for listening, and I hope we can have a discussion on some of these matters today. Thank you all.
Oh man, Jonnel, thank you so much. And as I'm listening to you talk, and I'm going down what we say memory lane, right? Which is we're 2 years now, and how much has changed and how much still continues need to be changed. And just hearing the numbers and the statistics, and I'm like just blown away. And the first question I had for you, because I've had a brief opportunity to work in workforce development, partner with CBOs prior to my time here, and even being here at the Field Center, having the SBDC here located on site.
Yeah.
What do you think is one of the biggest things that a business owner or just a New York City resident can do to become more aware of the plethora? There's resources out here, but sometimes I think there's a disconnect, like, wow, is that a free service? How long has this been around, right?
Yeah.
And do you think there's something that citizens can do to become more aware of what's afforded to them?
Part of the challenges, and I've worked in government for some time and in trying to manage these programs. And I think the big challenge is always around getting the information out. It is very difficult to reach a small business who the owner is operating as an owner, the CFO, the COO, the CTO, and all the others, right? It's hard for a small business, to owner to come up for air and to try to look for these opportunities. And so 2 things. One, I think you've got to make the time to actually make this part of your business practice and model, right? Which is, there's got to be allocated time for you to do research, to go look for, to make sure that you are seeking out opportunities and you're doing like what many of us are doing today. We are learning. We are finding opportunities to learn and grow. The second part is that those of us, and I was part of this, right, who have these programs, we need to continue to do the best to make them accessible and make folks know. I'm talking everyone from the federal side to the local side. That's our marketing strategy, our outreach strategy. Who are we actually targeting our programs to? I think one of the things that we found during the pandemic and sort of continue to evolve into sort of fixing the way that we approach the distribution of resources in such a limited with such a limited supply, is that we had to be extremely targeted. We had to then start to go down to not, when PPP came out, it essentially said, well, everybody, if you're under 500 employees, we were treating them, a business that has 500 employees the same, not we, the federal government was at the time, 500 employees and one with 5 employees the same way. Well, the sophistication is different. Their access to financing is different. Their capacity is different. So we've got to be very strategic in how we administer these funds and resources in a way that is equitable and in a way that can actually be accessible. And I think that's the role of us and government and authority and those who are providing these services also to think about this work, right? Are we making it easy for folks to get to us? Are we really refining our requirements? And then are we making sure that the information is getting out to as many people as possible?
Absolutely. Absolutely. There's a question in the chat that actually speaks to even talking about the ecosystem. And this question speaks to this, where it says, what do you think are some of the pros and cons of ongoing revised admission schemes for med school? And they gave an example of Temple University in North Philly has just started including community members, say small business owners, on the admissions committee. So what are some of the, yeah.
Yeah, that's interesting. I would say I'm not too familiar with that process. And so I don't want to, speak just without any real knowledge about it. But I find that, look, I think every institution must consider and look and evaluate, how you want to make an impact and who you want to use to make that impact. And I think ultimately, my principles have always been around equity and inclusion and diversity. Those are my driving principles in the things that I do. Whatever you're doing, are you making it a more equitable environment? Meaning, are you breaking down barriers and allowing others who may not have necessarily be able to get access, right? Number 2, are you making sure that the whatever you're implementing does not have a disparate impact on or unintended impact on these same individuals and who be seeking to engage, that we're creating some sort of a subset of a group, sort of specialized group that have access and others who don't. I've looked at everything that's going on through an equity lens, and if that measurement is met, then I think it's a productive engagement. And while I'm not sure about what was specifically asked, my general sort of approach to this, it's just everything has to be viewed through an equity lens. And once we do that, I think we'll have a lot more fairer policies and things being instituted across the board.
Absolutely. Great answer. I had an additional follow-up question about the ecosystem, because I believe that New York City, as much as there is, people, there's a lot of programming and resources. And I saw this from work in workforce development, and I've noticed that there are a number of organizations doing similar work from a CBO standpoint. And there's a lot of overlap sometimes in the work. So is there a way that, between the end user, the citizen, the New York City resident, the CBO, and the government, where there can be a greater connectivity with the understanding, connecting the ecosystem, right? Because you mentioned the social determinants of health, and there are organizations and government and programs in place that are addressing these things, but sometimes I feel like the work is overlapping where there can be greater collaboration.
One of the core principles that we had when I was commissioner was really around the concept of collaboration. And we had over 500, I think actually more than that, partners that helped us during the pandemic, including the 76 business improvement districts, the multiple merchants associations, the chambers of commerces. It was a combination of advocacy groups, financial groups, CDFIs, and the like, and the list goes on. And, you know, what the role I think government really plays, and I mentioned this in my talk, was around convening. Like, we have the power to convene. And so we were able to do that through the Small Business Advisory Council, pulling all these groups together to hear from them, and convene them. And then from there, birth sort of the policies that we saw, the shifts that we saw, the grants, you know, that we saw, the loan programs that we saw, the low interest loan programs that we saw, the educational programs, the mentoring programs, you know, 51 initiatives, right? We did. When you talk about over 600 million, at least under my tenure, 600 million in grants and loans being produced and pushed out, either connecting folks to it or doing it ourselves. You know, when I was leaving out the door in December or so, we released $100 million grant. It was gone in a week. I mean, it's, you know, the way that it was gone in a week, in the sense that we, you know, everybody was coming for it, because we utilized the ecosystem to spread the word. And, you know, so that everybody knew that this was coming, and everybody said, well, I'm going to help my community get, you know, access to this. I'm going to make sure that the bodega owner, the barber shop, you know, the taxi driver, I'm going to make sure that they know it's coming. And then what we did was, with our community partners, we allowed them to prepare the businesses to actually apply. Because what we found out in the pandemic, and during the pandemic, both in the federal programs, the state and local programs, is that their capacity to apply for and, you know, have the requisite information and back end and the back office support to do this is daunting. And a lot of small businesses just did not have it. And so what we said was, we're going to have entities who are going to support them, work with them, assist them in filling out paperwork, doing the back office, giving them the technical assistance and support. That is how you make this ecosystem work. And I'm not saying that everything was perfect, but I can tell you that we had a very you know, sort of specific and detailed approach to engagement. And I think that's where it all starts from. How do we engage? How do we engage? When I was a small business owner, I went to my bank and asked for a loan. My bank denied me my first business loan. If I was not working, I was working. I also, and this is where I found out about CDFIs. I found out about CDFIs because I was working in the state senate at the time. And I was, you know, I was doing economic development and so forth. And so when I thought about it, I said, well, man, let me check out this CDFI, Community Financial Development Institution. And it was through a CDFI, Axion, that I got my first business loan, when I was denied from one of the largest banks in the world, who was my bank for many, many years, which is another story for another day.
Right.
But you see what I'm saying? It's like, if I didn't know about it, because I was, you know, I would have thrown up my hands and probably said, man, what am I going to do now? You know, I got denied for no real reason, because just a month later, when they found out that I had 2 months later, when I found out I had a loan, I paid it back in full in 2 months. I started getting offers from the same bank. All right. And so they were either monitoring me, monitoring my credit, monitoring, and then when you know, and all that, which I had, you know, superb credit. I had clients. I walked in there with a list of my clients. I walked in there, but, you know, got denied. And I can say this, right, because my world is the equity world, and equity space. You know, Black businesses are twice as likely, in some cases 3 times as likely, to be denied loans than others. Women businesses as well be denied. Asian American businesses, Latino businesses, minority businesses are being denied access to capital all across the board, because of, you know, the systemic issues that are entrenched within our capital programs. And that's, again, that's another lunch and learn. But
Yeah,
let me tell you, it gets deep,
that's part
right?
two.
It gets deep.
And and you spoke to it, you began to speak to it with the story about your lending experience. And there was a question in chat that it was a follow-up and maybe a continuation. How did you actually fund your first business? So
Yeah. So yeah, I started with some money that I had, and I needed some additional dollars, as mentioned, and went to seek those dollars. But I was able to work out of my brand new apartment, and it was great. And so if I didn't have any overhead, and I had enough clients that, they started paying me monthly retainers. And so from that, I was using my money, but also, that those dollars were coming in, after about 2 or 3 months of running my business, the money started to come in, and I was able to manage it accordingly. And then I was able to go and get the additional funding from Axion. And then I was able to repay them shortly after that. And then, sort of do my business that way. So, yeah, I mean, didn't have a lot of money, but certainly I had something, and then used what I had and went after to get some more. And then, the business that was coming in was really how I sort of drove up, the amount of capital that I had. I was just really, really grinding really hard and making sure that I, had the customers, and was providing the services.
absolutely. My last question as we wrap, the saying that, and correct me if I'm wrong, that it's the squeaky wheel that gets the grease, gets the oil, right? And you spoke a lot about government's role and being intentional about policy and engagement in the ecosystem. We have a number of entrepreneurs on this lunch and learn, whether they're students, whether they're existing entrepreneurs. What would you say is one thing that existing entrepreneurs or aspiring entrepreneurs that can do to hold government accountable or bring things to government's awareness that can eventually help them as entrepreneurs in New York?
Yeah, I mean, so I think one, you've got to pique your curiosity a bit more, right? We've got to get out of our box, and we got to inquire. We've got to do some research. The Small Business Services great commissioner there now. Also, the work that Empire State Development Corporation, Hope Knight and her team is doing, the SBA, all of them have either information sessions, they have programs that they run, they have entrepreneurship fairs, and all the like. I would encourage you to seek them out and show up. And when you do that, I think you have an opportunity to voice your opinion, and also to let them know how their policies are impacting you as a small business. And I think everybody in those positions, because I know them, they care about small business. They care about the work, and they want to be helpful. And the whole agency is set aside called Small Business Services, right? We do, workforce, and, community investment within community groups and so on and so forth, supporting our bids and so on. But, it's small business.
Yeah.
And I think that's, where you go to. Contact the Small Business Services. They will help you. We have people lined up, hundreds of them, waiting to support your endeavor. And so, yeah, so thank you all for a great opportunity to be here and speak with you. This was amazing as usual.
Thank you so much. I appreciate you so much. We have, and this is actually our last lunch and learn for the fall. So I want to thank Jonnel for spending your time with us and presenting. Appreciate you totally for being with us today. Thank you all for participating with us. Please look out for a follow-up email with today's recording. Once again, today is our last Lunch and Learn for the fall 2022 semester, but we will resume in the spring of 2023. So keep a lookout on our Instagram account and also on our website for those dates. And we look forward to seeing you in the spring. Have a good day. Bye.